Hi, I'm Dr. Dadvand. I'm a board-certified plastic surgeon here in Beverly Hills. And today I want to do a case study on a breast reduction patient. Now this patient we actually filmed in the operating room, but I want to show some longer-term outcomes and talk to you guys about how I analyzed the case, what I was looking for, and my plan of attack, and what the outcomes are now. So this patient came to me for breast reduction, and I have the before and afters here up, but let me zoom in on the befores, and we'll go through this and what I analyzed when she came to me. So she's relatively young, in her early 20s, but you can see obviously very large breasts. They really cover up the entire torso. I mean, you can see what the distance is between the bottom of the breast and the belly button. And keep that in mind, because when I show you the after, we can compare to see how much of an improvement there is in that distance. Obviously the nipples are pixelated here, but we'll also be able to judge the improvement in nipple position, showing what the pixelation is like in the after photos. But automatically I see, when I first notice her before on the front view, that she's got some asymmetry, which is very common. The right breast is larger and a little bit lower, but you can just see how wide the breasts are. They're really coming into the arms here, and it's really taking up a lot of space on her torso, making it difficult to exercise, and it's really getting in the way of her being able to be fit and lose weight and be active in her life. So that's on the front view. Let me show you on the side view, or the 3/4 view. Again, more of the same, just very large pendulous breasts. And what this does is it puts a lot of strain on the shoulders. It causes lower neck and upper back pain. And in really severe cases, it can also cause rashes underneath the breast, especially in hot weather. And again, here on the profile view, you can see the bottom of the breast here, if you look at it, is almost at the level of the elbow. I mean, that's really low, and it's not appropriate for this patient. And so these are all the things that I had to consider when doing the breast reduction. So with every breast reduction, there's also a breast lift as well, because most women with really large breasts also have very low breasts. So I ended up planning a pretty significant reduction in her, but to also reshape the breasts and bring the nipples up to the normal position. So let's take a look at the after. And this after photo, in the original video, the afters that were shown were only about a week out. And so feel free to look at that video. It's on my YouTube channel, and you can click the link for that. But this now is a few months after surgery, and you can already see the improvement here. I'll bring up just from the front and the 3/4. Again, look at the distance in the before, the bottom of the breast to the belly button, and now look at it. So much more space now from the bottom of the breast here to the belly button here. The other thing is, look at the nipple position, the pixelation here versus the pixelation here. Huge difference, and it's just more proportionate to her frame. And if you kind of go back and take a look on the 3/4, a much better shape to the breast, right? It's not so wide, it doesn't take up all the space on her chest. And then also on the profile view, if I show you here, like I did before, here versus here, it's gone up about 7 inches. And that's really important, because not only does that look good and visually look appropriate, but just the weight that was relieved. I removed about 5 pounds, about 2.5 per side, a little bit more on the right to adjust for the asymmetry she had before. But imagine walking around with a 5-pound weight around your neck for your entire life. And so she's gotten a lot of relief from the procedure, and looks fantastic even at a few months out. And the incisions, which are already healing really nicely here, are going to continue to heal well over the first year. So let me give you a technical recap of what I actually did in the surgery. So obviously, I had to remove breast tissue. The way I designed the incisions were, so she has an incision around the areola, but I made the areolas much smaller as well, because her areolas were really large. So she's got an incision around the areola, one that goes down, and then one that goes underneath the breast. And the reason for that is because you need that kind of skin excision to take care of all the extra skin that's going to be there when you remove the breast tissue. A majority of the breast tissue that I removed was in the bottom half here, and that is because that's the stuff that is hanging the most. And then I end up moving the nipples up to here and then closing the skin around it. But before I do that, I also reshape the breast with internal sutures to make it more perky, make it narrower on her chest so it's not taking up so much of her chest. And you can see these breasts are not as wide as her original breasts. And so the technical recap is that, yeah, I took out, like I said, about 2.5 pounds per side, a little bit more on the right, reshape the breast tissue internally with internal sutures, and then reshape the skin over that to give her a nice contour. So I hope this was helpful for you guys, and I'd be happy to answer any other questions you may have about breast reduction surgery in the comments below. Till next time, guys.